Okay, we will be communicating on a pressure scale of 1 to 5 to help communicate the amount of pressure that you are feeling with my brushing. 1 is just going to be the weight of my hand. 2 is a little bit more pressure than that, but still very, very light. 3 is going to be even more pressure, can be a little bit painful, but it's considered a good pain or therapeutic pain. 4 is a little bit more painful than that, but it is still tolerable for a short period of time. You can breathe through it. And 5 is too painful and you need to stop right away. Okay, if you feel any change in comfort at all, feel free to go ahead and let me know what number we're at. I will be checking in with you as we are going through. Any questions about that pain scale? No. No pressure scale? Perfect. Can you get your hands on the table at your sides, please? Shoulder blows. Ah! Thanks, friend. That was right at the ready. So usually I always start with doing a nice sort of passing over the tissues involved. For her, it's her T-spine that needs work on. L-spine, quite mobile. And she's presenting with a little bit of a hyperlordosis. So this is like more the mid-earlier stages. Okay, that's okay. You can get lots of decompression in. Scanner, can I get you to just put your foot up against the, yeah. Just to stop moving the table, because I know we will. Nice big breath in. And so it is really effective to use breathing with a decompression, because you'll notice when she breathes in, her hips go backwards, in which I can encourage that posterior tilt. And then when she lets out, it's supposed to tip forward, but I'm not letting it. Right, nice slow breath in and out. And when you let go, I also like to do it with the breath as well too, so that there's no spring back of the tissues as well too. If they're experiencing pain in the low back, that could actually cause tissues to go into spasm, so don't back out too quickly. All right, so I am a big fan of neurodynamics, as you guys know, but whatever method you are comfortable with to encourage the tissues to lengthen, go for it. Okay, so you can use Swedish, sorry?
Let it go, let it drop.
You gonna start singing for us?
Good.
Let it go. Just kidding. Good, nice big breath in and out. So Nicole is a very balanced person because she takes care of herself. So that means she's not the best like demo for dysfunction because she's very functional. So, well then, good turn. But often people will be presenting with a slight drift on the table. We've talked about that before, right? Angelique, exactly. So then depending on if we see that there is a little bit of a drift would influence which side I would target first. In the real world situation, but according to board exams, unaffected side first. But are they gonna be complaining about the approximated side or the elongated side? You don't know, could be either, right? So it may look like I'm literally just in place, but I'm actually going, ebbing and flowing with her breath. All right, let it drop, let it fall. Good, as she breathes out, I kind of roll towards me. When she breathes in, I might push away, or vice versa. When she breathes in, I might roll her away. And when she breathes out, I might lean towards me. So the idea with the neurodynamic releases is theoretically, if she were not holding on to anything, I could push her off the table and none of her tissues would stop me. So the idea is when you engage the tissue, you can keep going, 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 and as soon as you feel a resistance, tissue is holding on. Let go of your leg, let her move, and then as soon as she lets go, I start going again, right? So that's the idea, is to reestablish that sort of mind-body connection with your patient. Because yeah, you can help encourage their tissues to let go. Awesome. But 1 hour on your table versus what they do the other 23 hours of the day. 1 hour, sure, it'll help, but that 23 hours will make a huge difference. So them learning how to let it go is going to be effective in their day-to-day. I didn't Exactly. And in fact, you can change the texture of your voice to be able to encourage further relaxation. Do you guys remember your fascia assignments that you did in however many terms ago? Did anybody do anything in their project regarding holographic fascia?
No.
Yeah, there is holographic fascia. I'm not even joking. And it's basically a response to